Did you know that hormone replacement therapy has been used for over 80 years to help manage symptoms of menopause and improve quality of life? It's more common than you think. Hormone replacement therapy, or HRT, is a medical treatment that's designed to help people experiencing hormonal imbalances. These imbalances often occur during menopause or andropause, which can cause a range of uncomfortable symptoms. By replacing hormones that are no longer produced in sufficient quantities, HRT aims to alleviate these symptoms and improve overall well-being. The goal of HRT is to restore hormonal balance, which can have a significant impact on a person's quality of life. It's not just about managing symptoms, it's about helping people feel like themselves again. For many, HRT can be a game changer. HRT has been used for decades, and its effectiveness in managing menopause symptoms has been well documented. Despite its long history, there's still some confusion about what HRT entails and who can benefit from it. Hormonal imbalances can cause a wide range of issues, from mild to severe. Mood swings are one of the most common symptoms, and they can be intense. One minute you're fine, and the next you're feeling anxious or irritable. Fatigue is another symptom that can be debilitating. It's not just feeling tired, it's a deep-seated exhaustion that can make everyday tasks feel like a chore. Weight gain is also a common complaint, particularly around the midsection. These symptoms can be frustrating and affect many areas of life, including relationships and work. They can also impact self-esteem and overall mental health. It's essential to address these symptoms and find a solution that works. Some people may experience sleep disturbances, while others may notice changes in their libido. The effects of hormonal imbalances can be far-reaching. Digestive issues and changes in skin texture are also possible symptoms. Hormonal imbalances can even affect cognitive function, leading to memory problems and difficulty concentrating. It's a complex issue that requires a comprehensive approach. In HRT, different types of hormones are used to address specific imbalances. The most common hormones used are estrogen and progesterone for women and testosterone for men. These hormones can be administered through various methods, including pills, patches, gels, and injections. The method of delivery depends on the individual and their specific needs. Some people may prefer a patch or gel, while others may find pills or injections more convenient. The goal is to find a method that works best for each person. The benefits of HRT can be significant. For many, it means relief from debilitating symptoms and a renewed sense of energy and vitality. However, like any medical treatment, HRT carries potential risks and side effects. These can include blood clots, stroke, and certain types of cancer. It's essential to discuss these risks with a healthcare provider to determine if HRT is right for you. They can help you weigh the benefits against the potential risks. Regular monitoring and adjustments to the treatment plan as needed can help minimize risks. It's a collaborative process between the individual and their healthcare provider. For example, I recall a patient who was struggling with severe menopause symptoms. She was experiencing hot flashes, mood swings, and fatigue. After starting HRT, she noticed a significant improvement in her symptoms. Within a few months, her hot flashes had decreased, and she had more energy. Her mood stabilized, and she felt like herself again. It was a transformative experience that allowed her to enjoy life without the burden of her symptoms. Stories like this illustrate the potential benefits of HRT. It's not a one-size-fits-all solution, but it can be a highly effective treatment for many people. The effects of HRT can be life-changing, but it's essential to approach it with a clear understanding of the potential benefits and risks. With the right guidance, individuals can make informed decisions about their care. In conclusion, HRT is a powerful tool for managing hormonal imbalances and improving quality of life. It's essential to understand its role and potential impact. By addressing hormonal imbalances, HRT can help alleviate a range of symptoms and improve overall well-being. It's a treatment that requires careful consideration and personalized medical advice. If you're considering HRT, it's crucial to consult with a healthcare provider to determine if it's right for you. They can help you navigate the process and find a treatment plan that works best for your needs. If you have any experiences with HRT, share them with us in the comments below. Don't forget to check out our other videos on health and wellness for more information. As we age, our bodies change, and so should our coffee habits. In this video, we explore the best coffee options for seniors, covering everything from caffeine sensitivity and health risks to stomach-friendly blends and nutrient-infused options. Learn which types of coffee, like decaf, Arabica, cold brew, and specialty blends, can support your energy, digestion, and overall well-being. Whether you're cutting back on caffeine or looking for coffee with added health benefits, this guide will help you find a brew that works for you. We'll also share tips on how to brew coffee that's gentler on your body, what ingredients to avoid, and how to enjoy coffee as part of a balanced lifestyle. If you're a senior looking for the right cup of coffee or helping someone who is, this video is for you.